Distribution of the single-dose Johnson & Johnson vaccine has been paused in the U.S. and delayed for rollout in Europe. This action came after the FDA and the CDC reported 6 known cases of a rare and severe type of blood clot linked to the J&J vaccine. On Tuesday, Dr. Anthony Fauci, director of the National Institutes for Health, had this to say.
This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million. We want to get this worked out as quickly as we possibly can. And that's why you see the word pause. In other words, you want to hold off for a bit and very well may go back to that, maybe with some conditions or maybe not.
For Insight, we're joined by Dr. Stephen Smith, an infectious disease specialist, head of the Smith Center for Infectious Diseases and Urban Health in New Jersey. Dr. Smith, thanks for being here. How worrisome is the pausing of this Johnson & Johnson vaccine? A few weeks ago, we saw a similar thing with the AstraZeneca vaccine in Europe.
Well, I mean, it's not very worrisome. I mean, the rate is very small. This debate would be a lot more difficult if this were the only vaccine or all the COVID vaccines cause this kind of side effect at this rate. And right now, it's less than 1 in a million. We use the polio virus vaccine in our babies for decades, and the rate of paralytic polio, giving that vaccine to those babies, was 1 in a million. And then there was another 1 in 500,000 chance that your grandfather got it or something. So we know vaccines have risks. And the question is, how much risk are we willing to accept for that vaccine in that situation? The smallpox vaccine had much higher adverse effects, much higher side effect profile than anything we'd use today. And they put up with it. No one was given informed consent back then. And we got rid of smallpox, eradicated from the earth. And so it just depends on how much risk you're willing to accept in this situation. In this situation, we have 2 vaccines that are very effective, and the third coming that don't have any signal of this. As you mentioned, AstraZeneca had similar patients, or subjects that got the vaccine in AstraZeneca in Europe and had the same clot happen. That doesn't mean they're causally linked. That just means it's another bit of evidence that the vaccine's doing it. And because we have other effective options that are safer or appear safer, there is not a huge debate right now, and that pause is going to be a very long pause, I have a feeling. Go ahead.
Is there any difference in the makeup of these vaccines that make one less prone to difficulties? And you say there are others on the horizon that could possibly have no side effects.
Well, we never say no side effects, never 0 to 100% in medicine, right?
Yeah.
So the first 2 vaccines are so-called RNA-based. And they don't even have any infection. They just kind of melt in your body. They're little bubbles of lipid or fat that merge with your cells, fuse with your cells, and the RNA goes in, and then they make the spike protein, and your body makes an immune response against the spike protein. These 2, AstraZeneca and the so-called J&J vaccine, they're adenovirus based. What does that mean? That means instead of using this lipid particle to get the genes of the virus into the cell, the gene of the spike protein into the cell, each of these viruses uses an adenovirus, which is a type of virus that can cause colds and a bunch of other types of infections. I think one of these viruses actually is an adenovirus from chimpanzees, but the virus is gutted. In any of these situations where we use so-called viral vectors, there's no live virus in the vaccine. It's just a single cycle, meaning the rearranged, genetically engineered adenovirus vaccine can only infect one cell. And then it injects the same way or similar way that the mRNA vaccines do by fusing with the cell the gene for the spike protein. But the 2 that have some signal of this clot problem are both adenovirus based, but they're different adenoviruses. So it's not clear that would make a difference or not. But there's enough there to slow down and look at it, and also say, well, we've got the 2 RNA vaccines, very effective, very safe. On the horizon, in the very soon horizon, we have the Novavax vaccine, I believe they've already filed with the FDA. They did their trials despite getting money from the US, over $1 billion. They did their trial in the UK, I believe, and they had 95% efficacy. So that's coming down. That should be approved in late May or June.
I want to get your reaction to something Dr. Fauci and the CDC have been saying. They claim that even if you're vaccinated, you have to continue to wear masks. This is White House spokesman Jen Psaki. Listen.
We believe that part of our objective is to model public health guidelines, and that means continuing to wear masks, continuing to hand wash, social distance. Hence, the president gave a primetime address where he said, when the vaccine's accessible to you and you get it, we can work towards having backyard barbecues.
Jen doesn't wear a mask during her press conferences, right?
Right.
No, you don't need a mask.
Exactly.
It's absurd. The CDC's recommendations are conflicting and hypocritical. So if you're fully vaccinated, meaning 2 weeks after the second shot for the RNA vaccines, or 2 weeks after the first shot for the J&J, that's fully vaccinated. You're not going to get infected. You're not going to spread it. The CDC says if you're fully vaccinated and you're going to a small gathering with other fully vaccinated people, no masks are needed. If you're fully vaccinated and you're visiting a house where there's people that aren't vaccinated, but they're low risk, I don't know how you're supposed to know that. I mean, doctors know that. Then you don't have to wear a mask. But in other situations, in the public, you need to wear a mask. That's absurd. The data are quite clear and stunning. There's more and more data coming every day. March 23rd issue of New England Journal of Medicine, which hasn't exactly been the most advanced anti-COVID measures magazine ever, has 3 articles from 3 different centers. One's from Israel, one's from UT Southwestern, and one is from the University of California at San Diego and UCLA. And there's a stunning reduction. This is healthcare workers that got fully vaccinated, and during that time, they swabbed their noses of asymptomatic people, and the rates plummeted, less than 0.05%, I think, in one study. I'm not a point percent, 0.17% in another study, and these are much, much lower rates than the healthcare workers that were not vaccinated or that were partially vaccinated. So the CDC can't have it both ways too. You can't say, well, you don't need masks when you're around vaccinated people, but when you're around other people, you do. Remember, the CDC's new theory about masks is that you're to protect you from protect other people around you. It doesn't protect the wearer. The CDC's own data show that. A randomized trial from the Danish study shows that. So they came with a new theory that if you're asymptomatically infected, this mask is going to decrease the number of droplets getting out in the environment and infecting those around you. But if you're fully vaccinated, the chance of you getting asymptomatically infected are extremely low. And so they know this. I have no idea why they have taken this policy, except I don't know. I really don't know.
Yeah. Well, I want the audience to understand, you actually treat COVID patients regularly and have treated them since the beginning of this, unlike many of these bureaucrats who are just looking at data.
Way too regularly. I've treated, I think, I stopped counting, over 500. It is funny to hear them talk about COVID like they know what they're talking about. They don't. They don't treat patients. They're administrators. And to be a leading infectious disease doctor in the United States, one should be treating patients as an infectious disease physician, as I have, as my father did before me. And it's quite a difference to be out there in the middle of it. And again, this is a very strange virus. I have a lot of respect for it, but the vaccines are very effective. The RNA vaccines are extremely effective. And so I don't know.
And what are you seeing? You told me, you and I were talking before we came on, you're seeing something very strange with this virus in the way that it's reoccurring, or the way that the immune system is reacting to it.
There's many unique things about this virus, and I got them all wrong. So when we get infected with the virus, and we're not vaccinated before, and we get our first-time infection, our body responds. And a big part of responding to a viral infection is production of our own antibodies against the virus, natural immunity. And when your antibodies come up, so you're infected with the virus, and your antibodies rise, the virus goes down and you get better, except in COVID. About 60% of our patients now being admitted, this has been going on for several months, maybe the whole time, are antibody positive. And they're not vaccinated antibody positive. They're unvaccinated, infected individuals who are getting worse and continue to get worse, need to be admitted because they're low oxygen levels, and they have their own antibody already in their blood. Their noses have the virus, so the blood has the antibody, they still have the virus, they're still very sick, getting sicker, and the antibody is either not doing anything or is making them sicker. I don't know. And I've never seen that. There's no description I can think of in infectious diseases where that occurs. And so that's why I was a little worried in the beginning, and go back to May, June, about would a vaccine work? Because we knew we had antibody positive, virus positive patients back then. And you don't see that. You don't see that with hepatitis B, for instance. You see it with some very strange infections that are chronic infections, but this is not a chronic infection. This is an acute infection that can last a long time and can and does get worse in some patients as their antibodies develop. It's ridiculous.
I got to play this for you, Dr. Smith, before I let you go. This is Thursday. Congressman Jim Jordan of Ohio demanded that Dr. Fauci give him a date for the end of these COVID mitigation measures. Listen.
We had 15 days to slow the spread, turned into 1 year of lost liberty. What measure, what standard, what objective outcome do we have to reach before Americans get their liberty and freedoms back?
I don't look at this as a liberty thing, Congressman Jordan.
Well, that's
I look
obvious.
At this as a public health thing.
Dr. Fauci went on, he refused to give a timeline or any statistics on what would constitute an end to these mitigation measures. What do you make of Dr. Fauci's answer, Dr. Smith?
It was evasive, of course. I mean, the data are there. I mean, you can't, the New England Journal published 3 different studies showing that fully vaccinated healthcare workers don't get infected, or are very, very, very low rate of getting infected, and no evidence that those that did get infected, that 0.5%, infect anybody, right? So this is it's like they don't want it to go away. There's friends of mine too that perseverated over getting the vaccine after being fearful of COVID for the last 13 months. We want this to go away, and it's ridiculous that people are wearing masks after they're fully vaccinated. There's no point to it except that we want to be egalitarian or something weird. So the vaccinated versus the non-vaccinated people. We don't look down upon the unvaccinated people. I don't know. I think the masks are part of the problem. My observations, the surges that have occurred in Jersey in October, starting late October through December, and now in March, still going on now, late February through March, people are wearing masks. And I think there's false confidence that these masks are protecting them. We know they don't. The masks now are theorized to protect people around the mask wearer, but not the person wearing the mask. If masks worked, I'd be all for it. If throwing salt, on my head would work, I'd do that. But I think they're part of the problem, and we know that fully vaccinated people, they certainly don't need them.
We will leave it there. We could go on for an hour, but we'll check back in with you because this is fascinating. And I love the idea that you are actually a practitioner who have been dealing with hundreds and hundreds of COVID patients, unlike so many of these people who are self-declared experts who look at spreadsheets and watch CNN. This is not an expert. This is a prognosticator or a pundit. So thank you for your insight and your expertise.